So I'm Tim, hi, and I will be presenting the results from the state-of-the-art of epidemic intelligence activities that we conducted with the whole team of colleagues involved in Mood. So first, let's start with what epidemic intelligence is. Epidemic intelligence is the use of both event-based signals and indicator-based signals that are being monitored, detected and verified and used for risk assessment of potential health hazards. The framework was actually initially written down or explained by Paquet in 2006. And on one end, you have indicator-based components of surveillance systems which produce some data that you will collect, analyze, and interpret. While from event-based component monitoring systems, you get some events. So this is from ad hoc reports, news outlets, any other event, something that is not collected in a systematic way. And these are events that you will capture, filter, and validate. Both those information make a signal that you will assess, and then you decide whether it requires investigation, dissemination, control measures, etc., etc. There was a state-of-the-art of epidemic intelligence activities in public health institutes of Europe that was conducted in 2006. And at that time, it focused on public health institutes. I'm sorry for repeating myself, but that's an important point. Our idea was that we would repeat a similar state-of-the-art with a broader perspective. We would focus on the whole Europe region. So it also included European free trade members. It also included candidate countries and neighboring countries. And we would look into both public health and animal health agencies. The survey was conducted in 2021, and our manuscript should be submitted before Christmas this year. So we conducted a web-based survey that was sent to animal health and public health gatekeepers from 42 countries or territories in Europe. Those gatekeepers were practitioners in epidemic intelligence in all those agencies, and we were interested into the data sources they used for event-based and indicator-based epidemic intelligence. What was the workflow for detection, verification, and assessment of signals and communication of alerts? And we were also interested in what type of international and intersectoral collaboration, meaning One Health, public health, animal health collaboration that was ongoing regarding epidemic intelligence. If you give me a second. So we were focusing on the mood disease models that, if you have already been to a few of our webinars, are aware of. We are interested in HPAI, West Nile virus as an endemic mosquito-borne disease that can be found both in human and animals, TBE, COVID-19, antimicrobial resistance, tularemia and leptospirosis that we will qualify as orphan diseases, and then exotic mosquito-borne diseases, chikungunya, dengue, and Zika. So we had a response rate that was slightly below 50%, with 34 respondents from 26 European countries by the end of the survey run. As you can see, the scope of respondents covered both public health, animal health, and One Health agencies in many countries. And despite a response rate that is not perfect, we were quite happy with the wide distribution of our respondents across the whole European region. The mandate of respondents was quite even, both on public health with 21 respondents and in animal health with 19 respondents. The range of infectious diseases monitored was quite wide, with a small advantage for animal infectious diseases. One interesting fact is that the resources dedicated to epidemic intelligence varied a lot. Out of 34 respondents, 32 were indeed conducting epidemic intelligence activities, but for 6 of them, only 1 full-time equivalent was dedicated to that, while there were more than 10 full-time equivalents in 9 out of 32 respondents. There was a dedicated team in almost half of the respondents who conducted epidemic intelligence activities. Now, regarding the diseases that were described, we asked our respondents to pick 3 of our model diseases in a very wide list, and we ended up with 19 answers on highly pathogenic avian influenza, 10 on seasonal influenza, 9 on West Nile virus in humans, 7 in West Nile virus in animals, etc., etc., etc. So our answers are quite broad because we cover quite a wide range of diseases, but on the other hand, we have quite a low number of respondents for each of those diseases. This is something to keep in mind when looking at our survey results. So getting a bit more into details, the data sources that were used for EI activities was very heterogeneous. On national level, a combination of IBS and EBS was the most common source reported across almost all disease, even though there were some particularities, for example, for IBS, indicator-based surveillance, which was the most common one, for tularemia and leptospirosis. Regarding activities conducted regarding other bordering countries and the rest of Europe, once again, IBS and EBS were the most commonly reported sources, with an exception again for tularemia and leptospirosis in animals, with the most common use of event-based surveillance systems. Now, when you look at the main sources for indicator-based activities, mandatory laboratory-based surveillance was the most commonly used for most disease systems, followed by sentinel laboratory-based surveillance, and a very heterogeneous use of syndromic surveillance systems, which I won't go into details here, but you can read that in the paper once we will have it published. The use of official public websites and official international notification was also very, very common. Now, once the data is collected, how was the whole collection, analysis, and interpretation of indicator-based signals conducted? It was a manual process for most disease. This was the most commonly used process, followed by semi-automatic methods. Now, the use of automatic methods was very rare and only reported by one of our respondents across all disease systems. If I follow with event-based activities, we identified that EBS was not used for some disease systems, from more than half of respondents for surveillance of orphan diseases of animals to 17% of respondents for invasive mosquito-borne diseases, meaning chikungunya, dengue, and Zika. The most commonly used source for EBS across all disease systems was scientific literature, followed by mainstream media and specialized internet sources like ProMed, HealthPap, and Gideon, which were quite ex aequo. The use of epidemic intelligence from open sources systems like EIOS was less commonly used across all disease systems. Now, if you look at the methods used for capturing, filtering, and validation, we also identified that several respondents, depending on the disease systems, reported they were not using any system that they had no process, that they were not doing anything for capturing, filtering, and validation. The use of manual methods then was twice more frequent than semi-automatic methods across most disease systems, which shows the need for trained humans, skilled humans to conduct that kind of work in the current situation for most respondents. Automatic methods here once again was reported by only one respondent across all disease systems, and it was for highly pathogenic avian influenza surveillance. If we move to cross-sectoral collaboration, it was quite heterogeneous. We had, for the group of mosquito-borne disease in humans, it was reported by 3/4 of more of respondents across those two disease systems, while it was reported by less than half respondents for orphan diseases, West Nile virus in animals, or SARS-CoV-2 in humans. The sharing of surveillance results was the most commonly reported area of collaboration, while we saw that surveillance design, data collection, and data management or storage was the area of collaboration for less than 40% of respondents across all disease systems, which shows that cross-sectoral collaboration is quite limited on national level across all disease systems. Now, regarding international collaboration, more than half respondents for most disease systems collaborated both with neighboring countries and with international structures. The strongest level of international collaboration was reported for SARS-CoV-2 in humans, seasonal influenza in humans, and highly pathogenic avian influenza. The main areas of collaboration were data sharing and surveillance design. We have a few preliminary conclusions. The role of laboratories is key for indicator-based surveillance. As we saw, mandatory lab-based surveillance is the main IBS data source. The tools for event-based surveillance the uptake of those tools is quite limited through all respondents, through all disease systems. And this is something we might need to think about a bit deeper. The access to these tools, possibly the need for trained personnel, etc., etc. We also saw that there was a strong use of scientific literature and official international notifications for event-based surveillance, which shows the importance of sharing data, sharing surveillance results to those international structures, as well as publishing findings, making sure findings are out. The use of automatic methods for processing of signals was quite low, and which shows the need for keeping human resources at a certain level across all agencies. And finally, we saw that there was a limited amount of intersectoral collaboration on the national level, showing that we might need to think of how to get better collaboration between Public Health, Animal Health Institute for Better One Health, account for better One Health collaboration. And normally I should be able to go to my final slides. I thank you for your attention. I'm available for any type of question.
Have some questions. I will try to reduce to the minimum. One is about if you've seen any difference when comparing data from international agencies and national agencies, because as you can imagine, the need for resources, the objective can be different. And then more of a, how to say, surprise, because you showed there that actually scientific literature and official international notifications are the main source for some agencies in which ECDC is included. And as part of the EI team in ECDC, I can say that that's not the case. So maybe just whether you think the answers from the survey could have been, like biased by the person from the team, the different teams that reply to those surveys. Thank you.
Thank you, Laura, for your question. So you're going to be very happy with my answer, I guess. The scope of the survey were the national agencies. So we did not survey ECDC EI team or WHO EI team, which is why you might think, oh, it's peculiar that they do not use much iOS. And second, it's from the, I could show very, very ugly tables right now, but maybe that's not the best thing to show right now. Overall, there is a strong use of official international notification and scientific literature, which I would say is almost ex aequo across all disease systems, which shows the importance of the ECDC roundtable reports and EpiPulse and all of your activities. So keep up doing that, please.
Thank you. So then I read it the other way. So instead that ECDC is using the scientific publication, the official notification refers to those done by ECDC, the World Organization for Animal Health, and so on, is how I should read it?
You should read it as national and public health agencies using your work.
Okay, because the way it was written, it seems that it was actually ECDC and the international organizations using those as first, because as you may know, the official notifications is not us that create those or the international agencies, it's the countries that following different regulations and different procedures will contact the different agencies and then we will disseminate as stated in these regulations. So it's not us creating the content. So maybe that's also good to clarify, because it's the country notifying, and then if needed, we can escalate that notification as said following the regulations, just to keep in mind for the publication.
I can make sure that it's clear that your role is the dissemination and not the production.
Well, not complete. We can follow this outside. Is what I mean is that the international official notifications, there are different scopes and different labels, you know. So if you say that a country have an official notification, it's not ECDC the sole entity providing this. So it's much more complex than just saying it's either the country or either us, because there are different channels, different sources, and different ways of disseminating things or even producing things. Hope that's clear. Thanks.
You sent the survey to national institutes, but from animal health, public health, and One Health. I was wondering that probably in some countries, this might be for One Health and public health, the same institution. Then how did you actually manage to do that? And I was also wondering, but I guess you already mentioned this, if you were also targeting some institutions that might work at the regional level within the country or with several countries.
So we focused, thank you very much for your question, Alba. So just a few clarification points. In order to identify our gatekeepers, we took some time to go through OIE national focal points and looked at ECDC NFPs or went through our contacts in those various national level public health institutes. We identified one gatekeeper from the animal health side and one from the public health side for each of those countries. Then, indeed, in some countries, some public health agencies wish to be referred as One Health agencies now. So we kept the One Health term here to make everybody happy. And now regarding regional agencies, we decided not to, because I know that for Germany, for example, it is very, very, you have quite a large amount of decentralization with responsibility of the lenders, but our focus was on national agencies. So why do we think that the response rate was so low? Yeah, so the response rate was quite low, and it might be due to several points, several key things. One is questionnaire fatigue. Any public health employee or animal health employee will tell you that they receive a huge amount of questionnaire all the time, whether it's about national focal point for surveillance, whether it's about specific questions on emerging vector-borne diseases and all. So it's very tough to get a good response rate. Second, I would say timing was horrible. And despite numerous reminders, text messages, threats, sometimes it was difficult to get the best response rate ever. But I'm not too unhappy with how spread are the respondents over the European region. And are we planning to do a regular survey to keep these numbers up to date and observe changes over time? Well, maybe we can add that to the top secret Mood 2 project or protocol for the near future. But I don't think we will manage to have this activity by the end of the Mood project. Yeah, so there is a very, very good question from Laura in the chat. Do I know or do I believe that the concept of EI was understood as the same for all responders? So actually, in the survey, we gave a definition of EI. I cannot say for sure if all responders understood it, but I can say that we did our best and we used the clearest definition possible. So it should have been understood in a similar way for all respondents. But I mean, you're working in epidemic intelligence, Laura, and I'm sure you know much better than me how people have difficulties understanding this concept. And many people do EI and are not actually aware that they do epidemic intelligence. Indeed.
In fact, thanks. And actually, there's one thing that since COVID, at least one of the positive things of the pandemic, is that this initial term that actually the publication you showed, there were some people from ETC involved, and also the report on EI, is that this distinction between event-based and indicator-based surveillance is really blurry. For example, if you put data from surveillance that is even being sent to TESI, our surveillance system, in a dashboard, is that event-based, indicator-based, both? So that's why I was wondering whether this, like changes in how we do things and the requirements in the different countries and even type of public health, animal health, One Health could have any, like impact in when trying to compare this landscape of EI in the different countries.
When are you planning to publish this paper?
That's excellent question, Valentina, because it gives me the opportunity to thank again all the people involved. But we are planning to have a final version by Christmas, and I'm hoping to submit it before Christmas. I'm Tim. I'm a medical epidemiologist by training, and I'm an alumni of the EPIET program. I've been working in Finland for 5 years now at THL, and I'm the deputy coordinator of Mood and strongly involved into the state-of-the-art of epidemic intelligence systems, which is focusing on what are the epidemic intelligence activities conducted by national public health and animal health agencies across broad Europe. Our interest is to look at what data sources they use and what are the processes that they use following collection of signals. First, and this is something that we did ensure when sending the survey, I am not 100% certain that every professional involved in surveillance activities are aware that they're actually doing epidemic intelligence. So, and this is a gap that is not something that we captured through the survey, but that's something to keep in mind when looking at our results. Second, I think that the use of event-based sources is quite limited across all disease surveillance systems compared to how it could be used. And third, I think one of the main difficulty that we have to always keep in mind is that the current assessment of signals and the current processes for the capture, filtering, and validation of events or the collection, analysis, interpretation of data are still mostly human-based, which means that you need professionals, humans, but you do not only need humans, you need humans that are trained in assessing those signals. So I think this is one of the main issues to keep in mind in the future. We need staff, we need trained staff. First, there was only one assessment conducted in Europe, and it was in 2006 and only on public health agencies. So there is no overview there is no updated overview from the public health side, and there was no overview from the animal health side. So I think that with that survey already, we can bring some more information. Second, we will be developing fact sheets for each of the main diseases that we covered. And I think that when developing on when willing to update your surveillance system, let's say, for example, for seasonal influenza in Finland, I could look at what other countries do and gather some ideas about the data sources that we could look into and about the processes. So this is also some kind of a guide of what other people do for my own development of a surveillance system, for example, or for my own update. And we would also like to use that information, like the information from our broader analysis is information for action. If very few countries are using semi-automatic methods or automatic methods, It is information about the gap here. Those methods are not present or not being used. Can we develop a tool to help practitioners? If we can, let's look into it then. I'm really looking forward to having that work published because I think it's important information that can be of use to others. And I think that the COVID pandemic has showed to all national gatekeepers, stakeholders, that we need good surveillance systems, that we need integrated surveillance systems. And I think that having that first assessment conducted in COVID times will be interesting information for action and further development by national gatekeepers. And quite interestingly, in the past week, I have been contacted by more than 3 younger professionals that are working on the assessment of epidemic intelligence activities in their countries or of epidemic intelligence tools that are being used in broader areas, and that asked me for further details, further involvement. So our information will be used by current work conducted by other professionals, and that's something I'm also looking forward